Okay, perfect. Thank you. That's the last of the consent forms we need to fill out. Thanks for your patience on those. I know they're kind of a pain. There's one more thing I wanted to talk about before we get started here, okay? Every time we meet, which is going to be about every other week or so, I'm going to have you fill out a form on my laptop here. If you look, I've got it pulled up. It's called the ACORN form. What it is, it's a list of thoughts, behaviors, and feelings that are common among youth that are receiving behavioral health services. Every time you fill out a form, please think about the last week and answer the questions as best you can. Just click the answer that best describes how you're feeling here. Okay, so if you have trouble understanding what the questions mean, that's not a problem. I can explain it to you, or if you prefer, I can just read you the questions off the form directly. One reason you fill this out is it gives me a snapshot view of how things have been going since the last time we met. It can also help us focus our session on things that are important to you. A lot of the teenagers I work with find that this process helps them organize their thoughts. Okay? I'm going to start each session by reviewing the answers with you here. So after you're done, give the computer back to me, but don't hit submit yet, okay? After I look at your answers with you, you can hit submit, and your answers will be uploaded onto a secure website that turns your bubbled responses into data points on a graph. We can look at your progress over time, and it can help us determine where to go in counseling. If we keep things the same, or if we need to make changes, that'll be indicated by what we see from your responses. After you fill out 3 of these forms, I can show you your graph, and we can see how the process is working for you. Does that make sense?
Yeah, I don't really want to do that. I just want to talk about my stuff.
Yeah, absolutely. I mean, that's exactly what we're going to do. That's why we're here. But this is something all the counselors in the agency use, and we're finding it really helps us get a better idea of your thoughts and feelings about our work, how you like the services we provide, how you think I'm doing as a counselor. And it really helps us keep on track by letting us know how things are going for you in your session.
Okay, but this is too much work. It looks like a test. I don't want to do it every time.
Yeah, I mean, I understand that, but I think you'll find it goes very quickly. It's always going to be the same questions on the same form, so you'll start to learn what they are without reading them in detail every time. If it's easier, I can read it to you, too. It's important for our work together that you do it every single time, though, because I don't want to miss an opportunity to talk about something with you that would really help us out.
So, if I'm doing this every time, who's going to be tracking me?
Okay. Your ID number here at the bottom of the form is specific to this agency, so no outside people are going to know it belongs to you. There's no identifying information included in the system. We only track age, race, diagnosis, and level of care to compare you to other people like you. I also want you to know that sometimes I share your progress with my supervisor just to demonstrate how therapy is working and to get help to make sure you are receiving the best care possible.
Will my mom be able to see my answers, or do you give this to my school?
Your answers are part of your clinical record, just like the notes I write up after every session. Nobody has access to your record unless you sign a release of information specifically allowing your ACORN answers to be shared. There are exceptions to this in special conditions, like a court order or abuse investigation, but generally speaking, we don't send your responses to anyone.
Okay, but I'm not going to answer the drug and alcohol questions. I have a probation officer, and I don't want them to know.
Okay. I understand that, but remember that your PO will not see your responses unless you specifically sign a release of information saying that I should send them your ACORN answers. This information is kept between you and me, and we talk about your drug and alcohol use in therapy anyway. You won't be asked anything on this questionnaire that isn't important to our work together.
Okay, fine, but I still don't want to fill out this form each and every time. It sounds so boring.
Maybe. But by completing the form every time, your answers will be translated into data points on this graph here that we'll be able to look at. It's your own personal graph that's going to tell a lot about you and about what's going on with you in treatment. There'll be different colored lines for different areas of your life that we can turn off and on. And there's a line so you can compare yourself to other teenagers like you. Every time you fill out the form, we'll get another data point on the graph, and we'll be able to see how it changes. We'll then be able to identify specific high or low points on the graph and talk about the coping skills you were using or things that were going on in your life that really helped you, or that made your symptoms even worse. A lot of my teenagers find this helpful. A lot of teenagers also like seeing that they're making improvement, especially when they're feeling frustrated or stuck. It will help me make sure I'm using the right therapy techniques with you. Every person's different, and if I see that a certain approach isn't working with you, I might change my strategy. The ACORN graph will help us figure out if what we're doing isn't working.
That sounds pretty cool, I guess, and it's like a personality tracker, right?
Right, it's kind of like that.
Are kids really honest with the questions on here?
Well, the more honest you can be on those questions, the more I can help you. These questions are really helpful to me because I take them as an opportunity to see how we can make things better for you in the way we work together. I've had kids who said they don't feel like I understand them, and I've thanked them for being honest. Then we talked about what was going on and how I could do things differently. That way we could have an open conversation about how therapy was going. We were able to work things out and make a plan to do things differently in the future. Then we followed through on it, and things got a lot better. And actually, there's research that shows that when you think our sessions together are helpful, if you feel like I understand you, and like you're able to talk about things that are important to you, then you'll get more benefit out of the therapy. But I need to know if you're feeling these things in order to help you, and these questions can help you figure that out. No matter how you answer the questions, I'm going to be happy that you answered them at all, and I'm going to thank you for doing that. I'm not ever going to be mad about it. It's very important that you answer these questions honestly, because I can't guess how you feel, so I need you to tell me if something's not working for you. My supervisor doesn't use these scores to evaluate me, so their only purpose is to make sure you and I are on the right track with your therapy. Does that make sense?
Yeah.
Thank you, and I really appreciate you taking the time to fill this out. It's going to help me a lot. So the next time we meet, I'm going to ask you to fill out this form right as we get started, okay?